Dear participants, it's a great pleasure for me to welcome you to this Info Day on the Work Programme 2024 of the Horizon Europe Health Cluster. My name is Irene Norstedt and I am the Director for the People Directorate in DG Research and Innovation. The Health Cluster, or the Health Programme, is the shared responsibility of 4 Commission DGs who are working closely together to deliver the health work programmes. I would like to welcome my colleagues Maya Matthews from DG Santé, Laurent Michel from DG Hera, and Lorena Bois Alonso from DG Connect. My colleagues will also be addressing you in a moment. Let me start by saying a few words about what you can expect from this Info Day. The purpose of this event is to present to you the 2024 work programme of the Health Cluster and the rationale behind it. You will be given an introduction to the research and innovation topics in the work programme, as well as the opportunity to ask questions in a dedicated question and answer sessions. Sessions on cross-cutting issues relevant for all applicants will also be made available to you. The 2-year work programme 23-24 was published in December 2022 on the European Commission's Funding and Tenders portal. Today's event focuses on the 2024 call topics, which open this year. We are inviting applicants to submit proposals for 15 topics with a total budget of more than €500 million. The single-stage call topics will open on the 26th of October this year. The 2-stage call topics are already open. The deadline for the single-stage call topics is the 11th of April in 2024, and for the 2-stage call topics, the deadline of the first stage is in September this year, 2023, actually on the 19th of September to be more precise. And for the second stage, it is on the 11th of April in 2024. For the single-stage call topics, applicants of shortlisted proposals can expect to be informed by the end of July. For 2-stage topics, applicants of shortlisted proposals will be informed by the end of January for the first stage and by the end of July for the second stage. I would now like to give you a brief introduction to the structure of the work programme and the rationale behind it. Just like the first work programme of the Health Cluster, the work programme 21-22, the present work programme covers 2 years, so now it's 23-24, and it is divided into 6 chapters or destinations. Each destination aims to deliver scientific health-related impacts and are the Health Cluster's contributions to the first Horizon Europe strategic plan, which covers the 4-year period 21-24. This work programme specifically targets research and innovation needs identified by the strategic plan and areas that had not already been addressed in the work programme 21-22. In the area of health, the Horizon Europe strategic plan primarily aims to supporting the WHO Sustainable Development Goal 3. This is to ensure healthy lives and promote well-being for all at all ages. As a successful applicant to our calls, your project should help realize the goals of the first Horizon Europe strategic plan and help to deliver solutions to health challenges that will benefit citizens in Europe and beyond. Let me now give you a brief overview of the content of our work programme in 2024. The first destination in the work programme addresses the prevention of diseases in older Europeans, as well as in younger ones living in the increasingly digital society. Focus is both on the physical and mental health. In 2024, Destination 1 will address the specific needs of children and adolescents. It will also support the development of personalized disease prevention approaches for non-communicable diseases. Destination 2 aims to improve our understanding of the links between environmental degradation and health impacts. This destination will focus on improving our understanding of the health impacts of endocrine disrupting chemicals and the role of environmental pollution such as air, noise, light, and waste pollution in non-communicable diseases. The Destination 3 addresses gaps in our current arsenal of intervention to manage and treat non-communicable diseases. Important challenges addressed under this destination are comparative effectiveness research for interventions in areas where the public health need is high, the validation of biomarkers for the prediction and prevention of brain disorders, and under-researched high-burden medical conditions. Destination 3 also addresses the needs for research and innovation to prevent future pandemics and emerging or re-emerging infectious diseases, including antimicrobial resistance. My colleague from DG Hera will give you further information on this point in a moment. Destination 4 of the work program aims to supporting our healthcare systems in their transformation to ensure fair access to sustainable healthcare services of high quality to all. Destination 4 will focus on the access to health and care for vulnerable groups. The fifth destination addressed the potential of new health technologies, and this destination will support the bioprinting of living cells for regenerative medicine, innovative tools and strategies that can replace animal testing in biomedical research. Finally, the sixth destination of this work program aims at stimulating the European health industry and making sure that it remains globally competitive and able to deliver the innovative solution we need. It will support research into new methodologies that can help improve the regulatory framework for medical devices, including in vitro diagnostic medical devices. I now hope that this brief introduction to the work program was useful to you, and I now have the pleasure of giving the floor to my colleague Maya Matthews, who will give you DG Santé's perspective on this work program. Thank you for your attention and have a good day.
Thank you, Irene. I'm Maya Matthews, Acting Director in Directorate General for Health and Food Safety at the European Commission, and I'm delighted to speak to you today. Over the past 2 years, our teams have worked closely together to connect health research and health policy. The COVID-19 pandemic has changed the way we live our lives and forced us to rethink the way we manage and protect public health and deliver care and treatment. From a health policy perspective, the COVID-19 pandemic has highlighted the need for more effective mechanisms to manage cross-border health threats at European level. It has exposed structural weaknesses in our health systems and supply chains, and a lack of investment into crisis management and preparedness. In addition, it has also underlined the importance of a coordinated approach at European level. As announced by Ursula von der Leyen, the President of the European Commission, in her 2020 State of the Union address, the Commission will build a strong European Union in which all 27 EU countries work together to respond to health crises, to ensure that medical supplies are available, affordable, and innovative, and to improve prevention, treatment, and care for diseases such as cancer. The COVID-19 pandemic taught us that we need sustainable, resilient, and accessible health systems to ensure that citizens' health is protected and public health is improved. For this to happen, the Commission recognizes that the Member States must be supported in their efforts. Therefore, the European Health Union will better equip the EU and its Member States to better prevent and address future pandemics, better protect the health of EU citizens through improved prevention, treatment, and care, and improve the resilience of Europe's health systems. In 2023, we are continuing to build the European Health Union with many building blocks already in place. Our teams work together to establish links between public health policy and Horizon Europe. I would like to mention a couple of initiatives which are ongoing. The first is the strengthening of our legislation on cross-border health threats, which cover preparedness, risk assessment, and risk management. We also strengthened the mandate of our two key EU agencies, the European Centre for Disease Prevention and Control and the European Medicines Agency. The health cluster has a significant role in this effort by contributing directly to this initiative. Secondly, on the 26th of April 2023, one of the key deliverables of the Pharmaceutical Strategy for Europe was adopted, with the Commission's proposal to revise the EU's pharmaceutical legislation, to make it more agile, flexible, and adapted to the needs of EU citizens and businesses. The revision will make medicines more available, accessible, and affordable. In addition, the Commission proposed a Council recommendation to step up the fight against antimicrobial resistance. The Horizon Europe Health Cluster has many actions related to both of these initiatives, supporting pharmaceutical innovation and tackling antimicrobial resistance. Europe's Beating Cancer Plan was launched in February 2021 and has a strong research component in the cancer mission and beyond. Finally, I would like to mention the area of digital health and the creation of the European Health Data Space, to which the Health Cluster Work Programme also significantly contributes in 2023 and 2024. In addition to these links between policy and research, we also try to align the financial instruments we have at our disposal. The new EU for Health programme is substantially reinforced compared to the previous public health programme. It affirms our commitment to reinforce our response to health crises, promoting health and preventing disease, while also supporting member states to build more resilient health systems. We aim to ensure complementarity between the investments in research and in public health. I see many opportunities for synergies between the EU for Health programme and the Horizon Europe Health Cluster, in particular in the fields of disease prevention and health promotion, digital health, mental health, health systems, and non-communicable diseases. I encourage you to have a look at both funding programs and their respective work programs and seize the opportunities available to contribute to better health for all. Thank you very much. And now I give the floor to my colleague Laurent Michel.
Thank you very much, Maya. Good morning, everybody. My name is Laurent Michel, and I'm the Deputy Head of Hera, the European Health Emergency and Preparedness Response Authority. Hera was created in September 2021, building on the lesson learned from COVID-19. The mission of Hera is to strengthen the ability of the EU and its member states to prevent, detect, and rapidly respond to cross-border health emergencies by ensuring that key medical countermeasures are available and accessible. In order to do so, at Hera, we look at the whole value chain, starting from intelligence gathering functions, support to research, innovation and development, all the way to distribution and stockpiling. With COVID-19, we have all realized the importance of adequately supporting research to increase the knowledge of the virus, help contain the spread of the pandemic, and facilitate the cure. Yet, the next health threat is already knocking at the door, and the Commission is working on different fronts to ensure that we are better prepared and able to react quickly. In this context, the promotion of research is crucial to accelerate the development of diagnostics, vaccines, and therapeutics for future health threats beyond COVID. Hera has identified three main priorities. The first includes pathogens with high pandemic or epidemic potentials, such as Ebola and Marburg virus, Lassa virus, and West Nile fever virus, to name just a few examples. The second category covers CBRN, chemical, biological, radiological, and nuclear threats. And the third category is represented by antimicrobial resistance. So how do we properly support research and innovation for pandemic preparedness? To do so, Hera can count on Horizon Europe. Horizon Europe is our tool to promote research and innovation to develop effective, safe, and affordable medical countermeasures for pandemic preparedness. Therefore, Hera is one of the 4 co-chairs of Cluster 1 and fully involved in the co-creation process. Over the period 2022-2027, the budget earmarked from Horizon Europe to Hera is 1.7 billion euros. Over 2023 and 2024, With a cumulative budget of around 630 million euros, we have co-developed some topics under Cluster 1 that aim to lay the foundation for the development of innovative solutions for prevention, diagnostics, and treatment of pathogens with pandemic potential. During the period 2023-2024, Hera will support in particular projects aiming to increase knowledge on immunity induced by vaccines against viruses with a high epidemic or pandemic potentials, as well as to define optimal vaccine design for pathogens where information on host pathogens interactions and viral surface structure is available. Hera will also support the development of and access to in vitro diagnostics for the detection and characterizations of pathogens with pandemic potentials. Building on existing adaptive platform trials and cohort studies, Hera, in close cooperation with DGRTD, will facilitate strategic coordination mechanisms in the Union and beyond to enable the conduct of perpetual platform trials and perpetual strategic calls. These trials and calls have the advantage that they can rapidly pivot to emerging diseases when an epidemic strikes and generate scientific evidence on different possible medical countermeasures. Moreover, other research actions for treatment will focus on advancing broad-spectrum antiviral compounds targeting viruses with high epidemic potentials. Global cooperation is key for pandemic preparedness. Hence, Hera supports the work done by CEPI, the Coalition for Epidemic Preparedness Innovation, to accelerate the development of relevant vaccines. In addition, Hera, together with DGRTD and in cooperation with member states, is involved in the preparatory phase of the EU Partnership on Pandemic Preparedness, which intends to develop a strategic research and innovation agenda by 2024. The upcoming One Health Antimicrobial Resistance Partnership will also contribute to addressing one of the three main priorities identified by Hera, namely antimicrobial resistance. Lastly, we need to support global efforts to maximize impact and promote a broad, holistic approach, especially by developing synergies across different Horizon Europe clusters and other funding programs. In this context, Cluster 1 provides a significant contribution to promoting innovation for being better prepared and able to prevent and quickly respond to any outbreak in the future. Thank you for your attention, and I would now like to give the floor to my colleague Lorena from DG Connect. Thank you.
Thank you, Laurent. My name is Lorena Boix Alonso, and I am the Director for Digital Society, Trust and Cybersecurity in DG Connect. I represent the co-chair for digital policies in the health cluster, and let me please say a few words about the impact of Europe's digital priorities on this cluster. Let me start with something important. We are all aware that our society is becoming increasingly digital and that this has a lot of benefits. I think that we all are enjoying those benefits and also some challenges. The good news is that the EU is fully committed to a secure, safe and sustainable digital transformation, a digital transformation which is in line with our EU core values and fundamental rights. And it is precisely the policy program for the path to the digital decade that sets up common objectives for Europe's digital transformation until 2030 that are fully aligned with our values. These objectives are centered on skills and infrastructure, as well as digital transformation of business and public services. Well, one of the core principles in this policy program is precisely about putting people and their rights at the center of the digital transformation. And in the area of public digital health services, the program has the ambitious goal of providing online access to electronic health records for 100% of citizens by 2030. As I was saying, these digital principles and objectives are fully aligned with the aims of the Horizon Europe Health Cluster, which is precisely to support inclusive, secure, and ethical digital solutions that benefit patients and that empower people to take control of their own health. Let me tell you now about the digital tools that are necessary for this transformation. As we know, digital technologies are today the main driver for innovation in the healthcare sector. And the COVID-19 pandemic has accelerated that digital transformation of our society, also when it comes to health research and healthcare provision. Now what we should do is to keep this momentum and to aim at maximizing the potential of digital health solutions to achieve high societal impact and cost efficiencies in the sector. The benefits of digital tools span across the health and care pathway, from supporting individuals in making healthy choices to helping medical doctors tailor treatments for a specific patient in a way that minimizes the side effects and ensures effectiveness. For example, artificial intelligence, advanced data analytics, and apps in mobile devices can support healthy living, prevention, diagnosis, treatments, and follow-up of patients. The health cluster advances research in all these areas for the benefit of healthy lives, personalized care, and patient empowerment. And there is something which is extremely important in digital transformation, which is the data. And here again, the European, we have strategies that put the citizen at the center of our data use. The European data strategy sets up a new European way of data governance and forms the basis for the European health data space. The main principles of the data strategy are to facilitate data flows within the EU and across sectors, and again, to provide control for citizens over their data. The citizen always at the center. Here we have two acts. We have the Data Governance Act and the Data Act. The Data Governance Act creates the processes and the structures that help data sharing by companies, individuals, and public sector. And the Data Act clarifies who can create value from data and under which conditions. The sector-specific common data spaces are fully aligned with the European values and rules on privacy, trust, and security. So to address the specificities of the health sector, the European Commission has proposed a regulatory framework for the European health data space in particular. And this framework ensures safe and secure exchange, use and reuse of health data, and again, always for better healthcare, delivery, research, innovation, and policy making. The Health Cluster Work Programme supports better integration and use of health-related data, data quality and utility label, and interoperability of electronic health records. And these actions bring valuable contributions and advancement to the data strategy and the European health data spaces. Here, the Commission, while building a Europe which is fit for the digital age, and I say it again, we always have at the center to protect, to empower, and respect citizens, and in particular, children and young people. And awareness-raising actions on children's online safety, well-being, and mental health are supported precisely under the Digital Europe programme. And this happens through the network of safer internet centers that are part of the Better Internet for Kids strategy. And the aim of these actions is to better understand the risks and the opportunities of children accessing digital content and services. And to complement these efforts, the health clusters supports research and innovation actions on holistic support to children and adolescents' health and care provision in an increasingly digital society. These actions include personalized approaches and solutions to manage, maintain, and improve children's and adolescents' own health, monitor health risk, and adopt healthy lifestyles in a rapidly changing and, again, increasingly digital society. So this is what I had to tell you today on the impact of the digital transformation on health and the other way around. And I thank you very much for your attention. And on behalf of myself and my fellow co-chairs of the Health Cluster, I wish you a very, very informative and fruitful Info Day.
Good morning, colleagues, and welcome to all of you who are following us online for this session. After the policy messages by the four co-chairs from DG RTD, Santé, Connect and Hera, we will now continue with the information session. My name is Søren Bøgert and I come from the Economic and Social Transition Units of DG RTD, and I'm responsible for the programming of Horizon Europe in Cluster 1. I'll be your moderator, together with my colleague Stefan Hogan, who is sitting over here, for the session on cross-cutting issues, which will start at 9:35. And before that, I would like to hand over to Stefan to give a short pre-recorded message about the activities of the Health and Digital Executive Agency. So over to you, Stefan.
Hello, my name is Stefan Hogan, Head of Unit for Health Research at the Health and Digital Executive Agency. I would like to present the agency and its role in supporting the European Commission in implementing Horizon Europe Health Cluster. The European Health and Digital Executive Agency, or Hadea, was established by the European Commission and is operational since April 2021. Executive agencies like Hadea are set up and supported by the European Commission to implement funding programs on its behalf. Hadea implements specific funding programs related to health, digital, food safety, industry, and space over the financial framework 2021 to 2027, with a total budget of just over 20 billion euros under its responsibility over that period. Hadea also manages ongoing projects launched through earlier programs, such as Horizon 2020. These are the programs that are implemented by the agency with the corresponding budgets. As you can see, just over half is dedicated to health. Firstly, through the EU for Health program, which has a budget of 5.3 billion, of which 4.7 billion is attributed through the agency. And secondly, through the health cluster of Horizon Europe, with 5.4 billion over 7 years. I would now like to outline how the executive agencies work with the Commission, and in other words, who does what. In short, one can say that the European Commission defines policy, while the executive agencies turn this policy into action. So, the Commission, in consultation with the Member States, define the priorities and strategy for each cluster, and ultimately translate this into annual work programs with the topics that constitute the calls for proposals. The Commission also makes key program decisions, including, for instance, approving the choice of experts identified by the agency for this evaluation, and selecting the projects to be funded based on the evaluation of proposals managed by the agency. And of course, the European Commission oversees and assesses the work and performance of the agencies. In complement, the role of the executive agencies is to implement the work program. In practice, for Hadea, this means publishing the calls for proposals for Horizon Europe Cluster 1 and Cluster 4, as well as for the Council mission, organizing the evaluations by independent experts, preparing the grant agreements for the shortlisted proposals, and monitoring the projects throughout their life cycle. They also support communication activities and provide feedback for policy making. At Hadea, in the case of the Horizon Europe Health Cluster, we report to 4 Directorates General of the European Commission: DG Research and Innovation, DG Connect, DG Santé, dealing with health and food safety, and DG Hera, the European Health Emergency Preparedness and Response Authority. This is the portfolio of health research projects monitored by the agency. So far, there are almost 260 Horizon Europe projects now ongoing for the health cluster and the cancer mission, and an additional 20 proposals are currently in grant agreement preparation phase. The average grant size is around 7 million euros, ranging from 2 million euros for coordination actions to 200 million euros for a very ambitious co-fund partnership with member states to assess risks from chemicals. In addition, Hadea monitors over 400 ongoing health research projects from the earlier Horizon 2020 program. This is an overview of the Horizon Europe Health Cluster calls for proposals in 2021 and 2022,
and their outcomes in terms of projects funded, total funding, and success rates. We can see that in 2021, the agency allocated some 986 million euros to 111 projects, and in 2022, some 851 million euros were awarded to 114 projects so far, with several more projects still expected to be added to these. And finally, this is an overview of the ongoing calls for proposals for 2023 and 2024. The 2023 calls are now closed and currently under evaluation, with the results expected at the beginning of August. For 2024, the two-stage calls are already open, as the deadline is already in September, while the single-stage calls will follow later, as they only close in April of 2024. Thank you for your attention. Please stay informed of developments at Hadea, and my best wishes to you in your endeavors to apply for EU funding.
Thanks to Stefan and to Hadea for the overview of the activities. And for you should by now have seen the presentation which are on the website with the open topics for 2024 in Horizon Europe Cluster 1 in Health. There's also a number of pre-recorded videos and other kinds of information related to the cross-cutting issues, for instance, on blind evaluations, international collaboration aspects, and how to evaluate social science and humanities, as well as how to deal with gender equality and the gender equality plan. So this is expected that you have already seen these things and can relate to this so that you can pose the questions directly to us. And I would very much like to encourage you to do this already now so that you have your questions in Slido so that we have a chance to answer as many of these questions as possible during the session. Questions that cannot be answered right now, they will be published in the frequently asked questions, which will be published here on this website, together with the recordings of these sessions as soon as they become available. You also have the chance to ask your national contact point for information and help, and they know the issues much better on the ground than sometimes we do. And that's why it's very important to reach out to them. And if no solution can be found, you can also use the Commission's research inquiry services, for which there will also be a link on this website. But I think let's now start the session, and we will do that with a pre-recorded presentation about the lump sum funding. This is very important for this year because it's the first year that we use lump sum in the health program. And even though it's only the first stage for that it's being used for, it's important because you need to prepare these actions also when you have to submit the second stage. So I would like to start the pre-recorded presentation on lump sum, please.
Well, for lump sum funding in Cluster 1, I think also seeing the questions that were received before the meeting, I think one remark in advance is that there are no Cluster 1 lump sum topics in 2023. So for Cluster 1, the first time that you are going to encounter this is with the 2024 work program. There might have been some confusion that people were looking for lump sum topics in 23, but there are none, because this then raised the question, how is this signaled and how do I know what is a lump sum topic? So if you have a lump sum topic, this will be entirely clear from the topic description that this topic is using lump sum funding. The principle is a topic is either using actual costs or lump sum funding. There's also two different model grant agreements. The topic description will be entirely clear which is which and what is necessary. So I'm going to give you a short presentation on the whole idea and the approach. Why do we use lump sum funding overall? You see three reasons on this slide. There are no particular order. Reducing the financial error rate, simplification, and more focus on content are the three main reasons. We have the obligation to reduce the financial error rate in the program, because this financial error rate is currently at above 4%, and the budget authority, the Court of Auditors, the Commission, the Council, the Parliament committees, they all agree this error rate has to come down, and lump sum funding is one key measure to achieve this. Because, and this brings me to the second point, it doesn't have the very sources of errors that exist in the actual cost world. Namely, we don't report actual cost and we don't have reporting of resources anymore. This is the main source of errors, and without these sources, the error rate is expected to go down drastically. And then at the same time, this is of course much easier to use because there is no financial management or no financial reporting at all, which is also of course a burden inside and outside the Commission. This is basically not the case anymore. This is not happening anymore in lump sum funding. And then with no financial management, the expectation is that we all are going to focus more on the content of the selected grants. So why is this easier for some and not for others, or how does this work with big and small beneficiaries? Here you see a distribution of small and big beneficiaries across the 42,000 unique beneficiaries in Horizon 2020. A big beneficiary here is defined as something, an organization that has more than 100 grants in the framework program. On the right-hand side, you see it's a tiny share of the beneficiaries in the framework program. And then it goes across to the smallest, which had just one grant in 7 years. And you see this is the vast majority. 2/3 of our unique beneficiaries had just one grant in 7 years. If I count the ones that had 1 or 2 grants, I come to 75% of all beneficiaries. And if an organization has 1 or 2 grants in 7 years, we cannot expect that organization to have dedicated staff or the experience, historical memory of how to handle framework program grants. So they are relying on a system that works without such dedicated structure, staff, and experience. And here I think lump sum funding is a big step in the right direction, a system that works for all beneficiaries, the big ones and the small ones. And this is what we need, because all of those will of course remain an essential part of the program. Basic principles of lump sums are that in the design of this approach, we have been following the standard approach as much as possible. So wherever possible, you find exactly the same that you may know from actual cost grants if you've been involved in other grants before. So it's the same proposal template. It's using the same evaluation criteria. The payments take place at exactly the same time. And we have exactly the same technical reporting template as well. What's different, I already mentioned, is the financial reporting. Effectively, it doesn't exist, or more specifically, it is automated. The principle of lump sum funding is that we have one pre-agreed lump sum share per work package. And once the work package is completed, we are going to pay precisely that lump sum share. In the grant agreement, the shares are further broken down by work package and beneficiary. And the simplicity of financial reporting is that as soon as one work package is declared completed at the end of a reporting period and accepted, that pre-agreed share is paid. And what you see here is an example of what this financial breakdown looks like in the grant agreement. This would be the equivalent of the financial annex, Annex 2 in the lump sum grant agreement. You see the share, here's an example of a project for 3 million euro. The lump sum is the same as the maximum grant amount before, or that's the maximum that can be reimbursed, the lump sum, and is broken down in shares per beneficiary and in shares per work package. When you write a lump sum proposal, again, the main principle is all the major elements are the same as before. You use the standard form, you present objectives and methodology in exactly the same way, and you describe the detail per work package as before. What's different is that you now have an additional detailed budget table where you provide the cost estimations per beneficiary and per work package. That is an Excel file that is supplied to you in the submission tool. So you find the right Excel file make sure that you use the one that is in the topic that is in the submission system. Don't use any other version that might be circulating, because indeed these Excel files might have been adapted specifically to your topic. For example, in case topics use other than the standard reimbursement rates. So that happens. Make sure you use the one in the submission system. So in here we see a bit more about this detailed budget, because that's a core difference between a lump sum proposal and an actual cost proposal. You have cost estimations for each cost category that is possible in Horizon Europe, and you provide these cost estimations then for each beneficiary and for each work package, and also for each affiliated entity if there are any. And then the principle is that these are approximations. These are proxies for actual cost. This does mean they are not meant to be accurate cost, but they are meant to be the best possible estimates at the time of writing the proposal. The eligibility rules are the same as for actual cost grants. So this article in the model grant agreement is effectively exactly the same. In other words, any cost item that is eligible in an actual cost grant can also be included in a lump sum budget. Then these cost estimations must be in line with the applicant's normal practices. That is it needs to be the best estimate possible at the time of, or reasonably possible at the time of proposal writing. And the key concept is that these costs must be reasonable and non-excessive. So they don't need to be accurate in the way that costs are accurate when they are reported ex post. Ex post, obviously, they need to be exactly the costs that were incurred, but upfront in a lump sum budget, they need to be estimations, and then the line, the measuring, the standard that we need to achieve is that they are reasonable and non-excessive. And this is exactly what experts are going to assess afterwards. Right, and then this table, this Excel sheet, this tool automatically generates the breakdown of costs that we already saw before, and that you then need, in case the project is selected, that you need to use as Annex 2 in the grant agreement during grant preparation. So the file is, of course, available in the submission system, I said, but for reference purposes, you can also find one on the funding and tenders portal, including with substantive instructions on how to fill this table. One other point to pay attention to when writing a proposal is the number of work packages. I already mentioned that work packages are the currency by which we pay. In other words, when work packages are completed, the pre-agreed share is reimbursed, but not before. So for work packages that traditionally last for a long time, like or for the entire duration of the project, like project management or other horizontal tasks like dissemination exploitation, you would only be able to be reimbursed at the end of the project. Now, this may not at all be a problem, and then it's also fine. But in case the project would like to have reimbursement earlier in order to optimize the cash flow or to have the same cash flow as in an equivalent actual cost project, it is entirely possible to split these work packages along the reporting periods. Example, you have a project management work package that lasts from the beginning to the end. You have 3 reporting periods. Now it's entirely possible to split this management work package in 3 equal work packages for project management, 1 in each reporting period, and thereby be reimbursed for the management activities at the end of each reporting period. So I insist this is an option in order, if needed or if desired, to have the same cash flow, but it's not at all an obligation. You may just as well also keep the project management as 1 work package, and likewise for other work packages. And this option to split, we of course inform our experts that they don't penalize projects for that. This is entirely possible for all work packages, including for the technical and scientific work packages, as long as the resulting work package is still effective and sensible. So we do not expect to see minute small work packages as a result. So that's the only thing that experts are going to check. But otherwise, splitting work packages is fine if desired to optimize the cash flow. When we come to evaluate a lump sum proposal, again, everything is the same. We use the standard evaluation criteria, excellence, impact, and implementation, as always. And then on top comes the evaluation of that lump sum budget. This happens under the implementation criterion. And what experts will do is to ensure, indeed, that's the key concept here, that these estimations are reasonable and non-excessive. They will also, of course, check that the resources and the split of the lump sum are fit to support the work proposed. So the splits across work packages and the split across beneficiaries must also be in line, of course, with the activities proposed. Now, experts can then, and this is in fact what we observe in the vast majority of selected projects, they can agree with the budget as proposed. I think we've seen, very roughly speaking, 90% of the lump sum proposals selected so far did not see any changes in the budget afterwards. 10% saw some minor changes, and these changes is what the experts put in the evaluation summary report in a way that should be easy and straightforward to implement. In other words, we brief experts that if they have such recommendations, that they be specific enough for beneficiaries, for prospective beneficiaries, to make the necessary changes in during grant preparation. In exceptional circumstances, a flawed budget can, of course, also lead to a decreased score. Now, but that is a rather rare thing to happen. This would really be the case if the budget is totally unfit, flawed, major underestimation or major overestimation of costs. That would maybe then indeed decrease the score and reduce the likelihood of being selected for funding. But be assured, any standard small changes, recommendations are just that, minor recommendations to change the budget, and they do not decrease the chance of the proposal to be funded. Well, and because we realize that lump sum funding is relatively new for many of you, we have created a dedicated page for lump sum funding on the Funding and Tenders portal, with all the available guidance, templates, and support material in one place. The link is here on the page. You can, for beginners, you can start with what do I need to know? That's a set of slides to explain the whole concept, and also takes you through the details of this lump sum budget table, which is, at least at proposal stage, the key difference. The quick guide gives you the background, why we are doing this, and the major principles. We have revised the set of frequently asked questions. The key guidance document is really this detailed guidance that is actually corporate, not only valid for Horizon Europe, but for all lump sum funding of Commission EU grants. It's been released a couple of months ago, and here that really I like to highlight as the official formal source of information that you should use. Otherwise, of course, all other links might be, I'm not going to go through all of them, but it might be equally useful to you. Let me just point out the event page, because all the external events are listed there. You can find the links to the event pages, and you have access to past events and recordings if you are interested. So this is the one source for further information to turn to. Where we are with this is that we have been testing lump sum funding in Horizon 2020, and after that we've had very, very little lump sum funding in the first 2 years, and we've used these first 2 years of Horizon Europe to massively improve the guidance and create, for example, that page and with lots of guidance documents. And now we're ready to go for the first really significant wave of lump sum funding. What comes with that is now a higher page limit for lump sum proposals. This is following feedback we got from the users of lump sum funding so far. This is effective with the work program 2023 in the general annexes. The higher page number, the higher page limit is justified due to that, due to the higher number of work packages that we see in lump sum grants. We go up by about 10%, so from 45 pages in research, innovation actions and innovation actions to 50 pages, and from 30 to 33 pages for coordination and support actions. We've just released an improved Excel tool that is going to be used certainly, for you in 24. We might have yet another improvement, we'll see, but there's one available now. And we are working on a collection of best practices from current grantees, from current beneficiaries, extracting their tips and tricks should hopefully help prospective applicants as well. Well, I think I leave it at that.
Thank you very much to Ulrich Genschel for the presentation of the lump sum funding. And now we will actually move on to your questions, which I hope you've already posted in Slido. I can see that some are already coming in, but please use the QR code, which you can see on the screen, because that makes it much easier for you. With me in the studio to try to answer your questions, we have, apart from Stefan Hogan, we have Isabel Fagara, and we have Rosanna Romario. They will answer questions related to, for instance, blind evaluation for Isabel and for international collaboration in health in the case of Rosanna. And joining us online, we have Anne Pepin from RTD D4, who's responsible for the gender equality provisions. And there will be links also, or there are links already provided on the website so that you can see further on this one. Then we have Katrin Romans Noteglou from our International Collaboration Unit, RTD F4, who will of course also answer questions about international collaboration. We have Pilar Gonzalez Pantaleon, who will answer questions on social science and humanities. And then we have Andrea Chicos from the Common Service for Business Processes, which will answer questions related to lump sum funding. And finally, we have Adina Ratoy from Hadea, who will answer questions related to the evaluation of and submission of proposals, and Jan Pala from DGRTD Combating Diseases Unit, who will answer questions related to the clinical trials. So with that, I would like to hand over to my co-moderator, Stefan Hogan, to lead us through the questions.
Thank you, Soren. And I think we can jump in straight into the questions. So I think for the first one, it's clearly about lump sums. So I think, Andrea, it's going to be for you. So the question is for the lump sums, what happens when we're audited? No need, or do we need to keep the same records as before? Or no need? Not sure. We don't have the sound.
We cannot hear you, Andrea.
Okay.
Now we hear you. We hear you now. Thank you.
Okay, perfect. So for lump sums, you have no contractual obligation to keep financial records for the project, as there is also no reporting of actual costs or resources. But of course, obligations to keep financial records outside the grant agreement may still apply, for example, under your internal procedures or under national law. And checks, reviews, and audits will focus on the proper implementation of the action and on any other non-financial obligation, such as the promotion of the action, the visibility of EU funding, ethics and research integrity, dissemination and exploitation of results, etc. So the records that should be kept, that we will ask for, are the technical, let's say, records. We won't ask for financial records.
Thank you, Andrea. Very clear. And I think the next question is also for you on lump sum projects. Who decides whether a work package is completed or not? How will this be decided?
Yes. So first of all, the consortium, the coordinator, will decide when the work package is completed. It's usually at the end of the reporting period. So the coordinator will have to declare it in the system and submit also the technical report. And then afterwards, the project officer will check if the activities have been carried out. So if the tasks have been completed, and we look also at the technical report, and based on that, we'll choose if the work package is completed or not, and the payment will be done according to the completion of the work package.
Thank you, Andrea. The next question is about blind evaluations. How do we describe previous projects and the work if one is not allowed to name organizations? Now, we realize there are limitations to this principle of not revealing yourself when you are referring to previous projects, but perhaps on that, blind evaluations?
Yes, you can make a reference of previous projects without saying that you were participating in this project. So this is already in the presentation. In one of the slides, you have some examples here on the type of text that you can include in your proposal. So yes, reference to previous projects can be included, but you cannot say that you or any of the participants of the proposal was participating in those projects.
Thank you, Isabel. I think I skipped a question. How do we mention cohorts in the first stage proposals? Please give an example of what information can be given without revealing the partner involved in the project. So, similar.
Yes. No, for this question, we have discussed with your services because this notion of the issue of the cohorts is very specific for the health goals. And we have agreed that you can include references to the cohort without naming or without giving the acronym of the cohort. So you can describe the cohort, but not give any reference also to nationality or any geographical detail. Yeah.
Thank you again. Now we're back to lump sums. How is the approximation checked? For instance, for example, will you ask for offers, quotations for items, equipment in grant preparation phase? Andrea, back to you.
Thank you. Cost estimations are evaluated by independent evaluator experts during the evaluation stage on the basis of the proposal, so the part B, the narrative part, together with a detailed budget table. They have the necessary scientific and technical knowledge, plus some knowledge on the financial management. So they will assess based on that. And we don't. So based on their evaluation, we will fix the lump sum in the grant agreement. And we don't go for negotiation or systematic revelation at the grant agreement preparation step. And regarding offers and quotations, we don't usually ask for that, so it's not the standard practice, but perhaps there might be exceptions, but it's not the standard practice.
Thank you again. So there's a question on project management. How do we split work program management along the reporting periods? If we have a 4-year project, we can have 4 work program management. Can you give an example? Well, in this case, I'm not sure who wants to jump in for this one. I don't think the work program management needs to be directly linked to the reporting periods. There will be work packages that can go throughout the project. Some may be more short-term, so it's not directly linked to the reporting periods. Anybody else want to comment on that?
Adina, perhaps?
Yes, if I may jump in, actually. Normally or typically a reporting period is 18 months. So if your project is 4 years, you can try to divide by having either 2 or 3 working packages, and the last one being one that can be a little bit longer than 18 months. So you can consider having work packages that cover a duration of 18 months in general, and the last one that could cover a little bit of a longer period or shorter.
Thank you, Adina. So now we have a question on SSH disciplines. What SSH disciplines are typically in health projects?
Yes, well, the typical disciplines will be sociology, psychology, history, geography could be also, because maybe disease can be in one area and not in another. It's important. Philosophy could be also, including ethics, economy, public administration, education, behavioral science. So this is just some examples. But maybe only one or two applies to your project. You don't need to include all of them, of course. Thank you.
Thank you, Pilar, for these examples, indeed. Now we are back to lump sums. Could you explain how the lump sum funding applies to projects with associated partners who are not receiving EU funding but contribute to work packages?
Sure. So the contribution of associated partners to the work packages in a lump sum grant works in the same way as the contribution of associated partners in an actual cost grant. So as you know, associated partners are entities that indeed implement parts of the action but don't receive EU funding. So they won't have to complete the detailed budget table at the proposal stage, so the Excel file. And in the lump sum grant agreement, they have no lump sum share associated to them. But we would still need that their activities or their contribution to the work package to be described in Part B of the proposal.
Andrea, I'm afraid we have several more questions on lump sums. Why do we not ask for detailed lump sum budgets during the grant negotiation only from those consortia who receive the grant? It would save us a lot of time.
Yes, so it is because this is the way lump sums are designed. So at the proposal step, indeed, we ask for a more detailed budget table to have an in-depth check of the cost estimations. And because also like further on in the during grant implementation step, we won't check the cost. So this is why we do it. And for topics in cluster 1 health, there are two-stage calls. So for the first stage calls, the detailed budget table is not needed. So only the proposal that would make to the second stage call would have to provide this detailed budget table.
Very clear, thank you. And is there any pre-financing in the lump sum projects?
Yes, it is. So the pre-financing in the lump sum projects works in the same way as for the actual cost grant. So it is calculated based on the duration of the project. So usually if your project has a duration of 2 years, you receive a pre-financing of 80%, which is quite generous. If it has a longer duration, the pre-financing would be smaller than that, but it works in the same way as for actual cost grants, and more details can also be found in the general annexes of the work program for 2023-2024.
Thank you. Now about blind evaluations again. When our activity is very innovative and atypical, the blind application is hard to maintain or keep blind since only one company is doing this. How can we do How can we do in this case?
For me, indeed, we are aware of this fact, and I would like to remind that what we are doing is a pilot here. So what we want to assess with this pilot is whether with the operational and legal framework that we work in Horizon Europe, whether we really can organize real blind evaluations. So from your side, as long as you do not reveal the identity of the applicant, so you should not be worried. So your proposal will be accepted for evaluation and evaluated. But for the assessment of the pilot, we will indeed check with the evaluators whether they could guess who is behind the proposal. So this will be part of the assessment of the pilot, and then so it will help us to decide whether we continue with blind evaluations or not in the research program.
Thank you, Isabel. Now a question on international cooperation. Are US partners eligible for funding?
Yes, thank you, Stefan. Participants from United States of America are eligible for funding, and this is in recognition of the fact that the US National Institutes of Health provide funding to European organizations. So yes, they can be beneficiaries, but of course each time it is better to check the conditions of the topic, because there you will find that indicated.
Thank you, Rosanna. That's clear. And now we're back to blind evaluations. Currently, blind evaluations is only at stage 1 and has limited effect. Is the long-term plan to have fully blind evaluations?
Well, this will also be part of the assessment, but I can already say that as long as we have an evaluation criterions that evaluate the quality and efficiency of the implementation of the proposal, we cannot have blind evaluations for full proposals. So we either change the standard evaluation criteria, or we can only apply blind evaluations in stage 1 of 2 stages calls. But it will be part of the assessment of the pilot.
Thank you, Isabel. And now back to you, Andrea, on lump sums. Should the project officer be informed of changes between the budget items within lump sum grants?
So yes, if the consortium would like to formalize the changes in the budget and to reflect those changes in the grant agreement, they should inform the project officer and do an amendment. So this would be, this is required, and this would lead to an updated Annex 2. And this might be useful, for example, to ensure that the financial liability follows the actual distribution of the lump sum shares among the partners. But if the partners consider that maybe it's not, it doesn't change very much, like these changes in the budget, they can also implement the project as it is, so as described in the grant agreement, so they don't need the amendment for that. It's only if they want to formalize the changes in the grant agreement.
And we're going to stay with you, Andrea, for the next question on lump sums. Does lump sum apply to national agencies and partners involved in a European partnership, or to the individual project consortia that apply to a call, or both?
Yes, I would say lump sum projects so apply to all the participants, all the organizations that would prepare a proposal, so submit it. And yes, so I think this is the answer, if I understood well the question.
Thank you. So now, we're going to go over to Anne Pépin for the next question concerning gender balance. Is in the overall proposal, how is the female-male ratio over 1 considered? Is the prevalence of female scholars appreciated or discouraged?
Thank you for the question. The objective is really to reach some gender balance among researchers involved in proposals. So, and that's a ranking criterion, so for a proposal with the same score. But this comes after 2 other items for prioritization for the ranking of proposals. So making sure that aspects of the call that are not otherwise covered, so these or the more highly ranked proposal, and then the score on excellence and impact, and it's the reverse for innovation actions. So then comes the gender balance among the researchers named in the researchers table in the proposal, and we are looking for parity, as close as possible as parity.
Thank you, Anne. That's very clear. And we're going to stay with you for the next question. When is the gender equality plan needed? At proposal submission or grant agreement preparation stage?
So it's actually at grant agreement preparation stage, so which means that your proposal has been selected, but you need to prepare in advance. So really, we recommend that you have that organizations that are subject to the gender equality plan eligibility criterion. So higher education institutions, research organization, and public bodies from member states or associated countries have a gender equality plan in place, complying with the minimum requirements and more at the time of the submission proposal. But if they don't, it will not block the submission process. It will not be considered during the evaluation process, but at grant agreement preparation, yes.
Thank you, Anne. Now, the next question may be subject to interpretation. How to be a member of a health cluster? I would like to be involved in this cluster forum in order to have the possible collaborations. Thank you. It really depends what you mean by health cluster. Now, we have different significance for a cluster. We call our program the Health Cluster of Horizon Europe. There can be clusters of projects, but if you're trying to network with other researchers in order to build a consortium, there are a number of avenues open to you, and I think the first I would mention would be the national contact points, which are very well networked and can help in consortium building, but there's also a number of partner search facilities, and some of these are available through our websites. I don't know if anybody wants to add something on this topic.
I think in general, if you really want to be part of the activities that are going on in these clusters, then you need to reach out also throughout info days and brokerage event to make sure that you know the people who are involved, and then you can also tailor your interaction into the proposals with these things. So I think it's a lot of different kinds of things. The most important being those that Stefan is talking about here now, but I think in general the networking is really, really important if you really want to be involved in the cluster.
Thank you, Soren. I think we're back to lump sums with the next question. Will the payment be based on activities finalized or work programs finalized, work packages finalized? Thanks. It's not very clear, apparently.
Sure. So the payment of the work package will be based on the completion of that work package. So at the end of the reporting period, the coordinator will have to declare if the specific work package have been completed or not, and we'll have to submit the technical report, and then the project officers will check the completion of the work package, and if it is declared as completed, will get paid. And what does it mean? Work package completed is when all the essential tasks have been completed or equivalent tasks have been carried out, and also when deviations have been justified, if any. But essentially, when the essential tasks have been completed.
Thank you, Andrea, for these clarifications and lump sums. The next questions are about international cooperation again. The first one, is Canada allowed to participate in the non-animal models topic, and can it receive funding?
Thank you, Stefan. So Canada, and of course, if there are specific questions on this topic, on animal model, it's better to refer to the session where the topic will be presented. But yes, Canada can participate to all topics. And since Canada, it is a high-income third country, normally it is not allowed to receive EU contribution. Of course, there may be exceptions, for example, that the participation of a certain Canadian organization is relevant and important for the topic, and therefore this may change. But let's say in normal conditions, Canada does not receive EU contribution.
Thank you, Rosanna. The next question is also on international cooperation. Are there 2024 topics where co-funding of non-EU countries is foreseen?
So, in general, high-income third countries provide co-funding to participants that participate in the health cluster. However, there are cases where a specific country may indicate a specific topic where they intend really to contribute. For example, we learned from the government of India that they would like in particular to co-fund the topic disease 13. I will not say all the title, but just to say that in some case, countries, yes, prefer to specify one single topic, or more topics, of course.
Thank you, Rosanna. So we've exhausted the current questions. I invite you to send in more questions. The QR code is available if you still have questions that haven't been addressed. Otherwise, I may open for a quick round amongst the panel to see if there are key messages that they would like to take the opportunity of making beyond the questions that they've received, issues that may come up frequently or that they feel need to reinforce. So on lump sums, on international cooperation, on the gender aspects, on SSH, on the blind evaluation. If there's anyone who wants to, amongst their colleagues, who wants to say something.
If I may take the floor, Stefan.
Adina, please.
From the side of the agency, we would like to recommend the applicants to read carefully the topics and what the topic requires. And if they have any questions on that, to go directly to the national contact points and try to sort out these questions before they apply. Of course, they can also contact us via the Research Inquiry Service, but normally they should read the text carefully, try to understand it, and if they have questions, to check them with the national contact points. Also, if they need to know whether they are eligible to apply or if they can apply, also go directly to the national contact point and check this out. So this is from us, and also read carefully the template of the application, because it provides clear instructions on how to draft your proposal. Thank you.
Thank you, Adina. Good advice, and indeed also recalling that there's, as an introduction to the work program, you can also view the videos which have been recorded for covering each destination. All the topics are covered. They're available via the website of the web page of this event. They're usually short, quite compact, and give you already a clear overview of the topic before you, or in addition to what you will read from the work program. We also have Jan Paller with us, who is the expert on clinical trials. So I don't know if Jan, if you want to take the opportunity to say anything about clinical trials, recalling that quite a few of our topics enable the funding of clinical trials.
Yes, thanks a lot, Stefan. And I would refer to what Adina has said. Read the guidance document and what you have said, the video that explains the additional information that can be submitted through a particular template on clinical studies. And important to note in this context that we define clinical studies much broader than clinical trials, so of medicinal products, devices, but also interventions in the broader sense, cohorts, and other studies that fall under this remit, and it's defined in the template and also referenced in each of the topics where this may be relevant. So if you are proposing a clinical study and the topic mentions that clinical studies are welcome, then you're requested to provide additional information in a structured format in the template, which will make the evaluation of the proposals and the comparison much more effective and fair.
Thank you very much, Jan. In the meantime, we've received a couple of more questions. The first one is on blind evaluations. Do applicants need to change their project acronym if it refers to a previous project? Not good for project, although this may not be good for project visibility. So, Isabel.
Well, I could say it's not needed really, yeah. So it will be your decision, but of course, we will not reject the proposal because you use this acronym that it was used in a previous project. Yeah, but it's the decision of the participants. Yeah.
Thank you. And on international cooperation again, is it an advantage to include partners from India in addressing this specific topic, which I guess is the one you referred to, Rosanna?
Yes, well, the advantage or disadvantage depends really on the consortium and on the role that the potential Indian partners or partner would have in the proposal. So it is not a matter of, let's say, advantage. The important to say is, as I said before, that Indian participants would be funded. So this is very important because, of course, it would contribute to the general, to the overall budget of the proposal. Therefore, but again, it really depends on the content and on the purpose of the proposal itself.
Thank you, Rosa. Thank you, Rosanna. And staying on the topic of international cooperation, I'd like to give the floor to Catherine, who maybe would like to bring a few points up also on international cooperation in our program.
Yes, I just wanted to add a few words on the previous questions. So for Canada, indeed, they are eligible to participate. Normally, if not otherwise mentioned, this is without funding. I just wanted to mention that Canada is one example of those countries that have co-funding mechanisms in place. So they have a national envelope aside to support their entities to participate in Horizon Europe activities. So I would just suggest to go and look in the co-funding mechanism guide, which is on the funding and tender portal. But this is under revision, and we still need to upload the final version. So it will come soon for all the updates. But all countries, which are for the moment 11 countries that have co-funding mechanisms in place, there is a section on how and where to reach to find more information on how to apply for these national funding opportunities to participate in Horizon Europe. That's one thing I wanted to add.
Thank you. Very welcome, Catherine, to have this additional information on international cooperation, and in particular with specific countries which have these mechanisms in place. Now we're going to come back to lump sums, a popular subject. Of course, it's in place for all the topics of the two-stage call as well as the blind evaluation. So it's a very special call for us. So with regards to lump sums, how will the pre-financing be determined? Also, will the pre-financed amount be deduced from the first period payment? Isabel. Sorry.
I can answer, but Andrea was there, but I can also answer this, yeah. So the pre-financing will be determined in exactly the same way as in real cost projects. So we normally paid 150% of the average funding per period. This is what we normally do. It can vary. It may vary from call to call. But what we never do is to deduct the pre-financing for subsequent payments. This we don't do, yeah. So we pay a pre-financing at the start of the project. Then in the first reporting period, you declare your cost. We pay your cost. And then the pre-financing that was paid at the start of the project will be a funding flow that you will use for the rest of the life of the project. But what we have is a limitation of the maximum payment that we can pay before the final. So we can only pay until 90% of the funding. And this is maybe the reason why you think that we are deducting the pre-financing. So this is not the case, yeah. So we just pay in every reporting period the cost that you declare. In the case of lump sums, the work packages that you finalized. But with the limitation that we can only pay in interim periods until 90% of the total budget.
And of course, sorry, I should have addressed this first to Andrea. Apologies. Andrea, do you have anything to add? I think we have a fairly comprehensive answer already.
Indeed, nothing to add.
Thank you. Thank you. And I think now for the next question, I might go to Adina. For two-step calls, or the two-stage calls, does the first application undergo formal expert review, peer review, or are these initial applications reviewed by a more generalist panel?
So the two-stage calls and two-stage evaluations are obviously divided into two. For each stage of the evaluation, there are different, we have award criteria that are tailored specifically for that specific stage. And in each case, in each step of the evaluation, we use experts that normally cover the expertise that needs to be covered by that specific proposal. So, so for each step of the evaluation, we will use experts that have expertise in that specific area of the proposal. I hope I answered clearly.
So maybe to reinforce that we do not use more generalist panels in the first stage. We used the best possible expertise we can have. Thank you. Again, we're out of questions, so not sure if there's another round of comments from colleagues. Anybody wants to put across an additional message, something that may not have been mentioned yet?
If I may, still me?
Yes, Adina, please.
Yes, I just wanted to give some kind of a message, a more practical message to the applicants. Most of them, we have noticed they would submit the proposal in the very last day, in the very last minute. We strongly recommend that they do not do so. So try to submit your application at least a couple of days before the deadline of the call, and be aware that if you make any changes, last-minute changes, in particular in the budget table, please check that you have saved that information and that you have not submitted it with the wrong amounts, with the wrong budget, and so on. So whenever you make a change, last-minute change, save it and then check that this is what you wanted to have in your proposal, and do not leave it for the last minute. Thank you.
Thank you, Adina, and you're very well placed to see these problems as the call coordinator, the main call coordinator for the health cluster at the Health and Digital Executive Agency. You're in the front line of all these issues that may arise at the last moment, sometimes because people really wait until the last minute to press the button, and that can be a risky strategy. I think we've out of questions, so I'm going to hand over back to you, Soren, and I want to thank the panel for their spontaneous responses. Most of this is on the cuff. And I want to thank the audience for sending us these interesting questions, and we hope we have addressed them well. You can always still send questions, and we will answer in writing, as Soren mentioned earlier on. So back to you, Soren.
Thank you very much, Stefan. Let me just reinforce the last message that Adina gave. I think that the worst thing you can do as a coordinator of a proposal is to submit it after the deadline. Can you imagine your colleagues looking at you if you have submitted 5 minutes after 5 and you are not allowed into the proposals, into the evaluation? I think that's a mistake which is pretty serious. So please don't do this. And if there are any kind of problems on the web and stuff like that, you are the responsible partner for making sure that this is happening. Like this, the best strategy, if you're really late with certain things, is to put things already in place, perhaps not fully ready, but so at least you can press the button and you have something in the system. Okay. With this, I would like to conclude this first session on the cross-cutting issues in Cluster 1 for the Info Day. And I would like to thank you for the attention throughout this session and posing some interesting questions to the panel here. And I would also like to thank my colleagues in the panel for answering the questions and being quite comprehensive about this, as well as the Slido operators, which are sitting in the back row, which you cannot see, but they are also doing a big job making sure that this can happen flawlessly. So please don't forget to consult the FAQ for further reference and to use your NCP. The NCPs are there for you, and we will concern with them in the next short session also. But right now we're going to take a short break. Thank you. Dear colleagues, welcome back to the information session. After the short bio break, we will now go to the NCP session, and I would like to hand over to my colleague Stefan Hogan, sitting next to me. Please, Stefan.
Thank you, Søren. Now we're into the final part of this introductory session, and I would like to introduce Caterina Buonocore from the Italian Agency for the Promotion of European Research. Caterina is the national contact point for health in Italy, and she's also the coordinator of HNN 3.0, the EU-funded project for networking and enhancing the services of NCPs. So, Caterina, you're very welcome, and thank you for this presentation. We don't hear it, we don't have the sound for the moment.
Thank you. Good morning. Good morning to the audience, to the people and the colleagues in the studio. I hope my audio is now fine. Can you confirm? Thank you for hosting the National Contact Point in this very important information session of the 1st of June. We are part of the, indeed, support process that the European Commission has put in place internationally with this network of national contact points. And we really feel we want to help the applicants, and that's why we are working hard, I would say, also with this new initiative, Health NCP Net 3.0, that the European Commission has funded in the previous, in the first work program, where the national contact point have a space to professionalize themselves transnationally with the support of the knowledge that every country has, and to improve our skills, because as you heard, there are always new features to think of during proposal preparation. So we really want to be there, ready to support you in this process. So this project is composed by 16 partners, and the important fact is that we started last year, and we are going to have these services I will introduce today running until May 2029. So we basically go over the duration of Horizon Europe, also to bridge the process of changing to the new work program. Next slide, please. We want to make clear today also for the newcomers of the program, which might not know the presence and which might not know the national contact point in their country. We are, first of all, a European international network of individuals where in each member state, so the 27 member states, but not only, also in the associated countries to Horizon Europe, and also outside the European borders, we have different and several national contact points, which are nominated, and this is important to know, by the national authorities. So the national networks in the countries are managed by always a single national authority. The national contact points are individuals like me. There are several colleagues around the world who are nominated by European Commission. This is also a very important feature under the proposal of their own government. That's why we want to say that the information that the national contact point are distributing in the countries and internationally are first-hand information that Hadea and European Commission are giving us during certain events that are organized every 6 months, but even monthly. We are in touch with our colleagues at European Commission. So our mission, very broadly, is defined really as a public service of information, but not only, also a guidance on the framework program participation. We are delivering certain services which are described in a very important document, which is the NCP Guiding Principle document, which is published by European Commission and updated now and then. But that's a very important document where the function of the NCPs, the role and the services are well described. Another important feature I would like to underline is that although we have this document, we know that NCPs are doing information campaigns, we are organizing info sessions in the countries, we are assisting our client, but this assistance is generally diverse depending on the country. So we have this project Health NCP Net also as a way to coordinate the work of the NCPs, to offer the applicant an harmonized service, but check with your national contact point always nationally what type of services they can give you. And the place where you, of course, find the list of national contact points, nominated ones, is the funding and tender portal. Next slide, please. What we are doing transnationally with the Health NCP Net project, we have launched already 10 months ago this very important information hub. healthncp.net is our hub of information on the health sector. Here you will find a selection of information, services, funding opportunities that the NCPs in this project are selecting for you and offering you in a quite structured and filtered way. I will show you some pages of the web page just to tell you that indeed it's important to follow us to really make your job easier also in identifying funding opportunities. Next slide, please. So what we do is really not offering you service for NCP only, but also for applicants, and that's why we are here today to talk about this, because together with the other colleagues, we are actually in the process of delivering several nice tools which are useful during the process application. Next slide, please. Next. Thank you. About our activities and product, I'm going to mention a few initiatives. What you see on the left is really what we are doing among national contact points, because that part is really crucial, because we want to offer you a better service. So that's why we invest time and resources to build an information flow which is stable among this international community of NCPs. We have training activities among ourselves. We do mentoring thanks to Hadea and European Commission, where we actually ask them to inform us and to train us on specific challenging aspects. We have a staff exchange scheme. We meet basically every month for what we call a coffee for health NCPs, where we discuss indeed what is problematic around the calls. And we have also networking established with the Partnership for Health. As you know, the Cluster Health has also a panorama of 9 health partnership, public and private, with whom we are establishing contact to better inform you. For the applicants, we have first in a row brokerage event. As you know, tomorrow there is on the 2nd of June a brokerage event dedicated to you on the 2024 topics. Actually, we have about 800 participants for tomorrow, with really a big amount of meetings to favor the networking and the building of a new consortium. Also for applicants, we have information channels. So we always ask you to subscribe to our social media and to our electronic newsletters. but we also organize and will organize workshops to inform you about specific aspects of the topics. We have also a specific emphasis targeting widening countries, so those countries who have, let's say, a minor success rate or less intensity of participation in the calls. Next slide, please. So a few of the events we have organized that you have probably participated, the brokerage event in January. It's important to say that although the brokerage event is over, but we always leave on the page the list of pitches which were held available, and generally the platform of brokerage event are open for a few months after the brokerage event, so that each of you can enter the platform and review the partners who have subscribed and make new contact, new research contact through this platform. This is a very important service for us. It was very much requested that we receive many times the request from clients in how do I get in touch with other expertise in Europe or outside Europe, and that's really for us the way to go. On the right side, you see indeed that tomorrow there is this brokerage event on the 2024 topics. I invite you to join the online session where the pitching session will be held. Although even if you're not registered to this brokerage, it's still important that you participate to learn about new offers from different countries, always with the scope of enlarging your research networks. Next slide, please. So about product, we are also focusing lately on some toolkits, that's how we call them, but basically we work on very practical tools where we try to support the NCP work, always to support you better. So we really believe that also the website we have built, it's an opportunity to make your job easier, and I will also show you with one slide. For the applicant, we are also working on several features. I would like to mention the annotated template. You have a RIA template, and we are working on making this template commented with specific annotations which can help you while you draft your proposal. Fact sheet is also an opportunity. We will develop some online tutorial, very short on very specific challenging part of the proposal, and guiding documents. We are also in the process of identifying success stories, so we will actually ask you applicants if you want to be interviewed on especially impactful results of your project. Next slide, please. Yes, this is the part of the website where we show the funding opportunities. As you see from the menu, we are here mentioning, of course, Horizon Europe call for cluster health. The mission cancer is also, of course, mentioned in the website, and also the calls from all the health-related initiatives, partnership, which I mentioned, but also other health-related programs, for example, EU for Health. For us, it's a big challenge, so we will also mention it in our calendar of funding opportunities. Next slide, please. On the product, I zoom on these three already available documents, the guidelines for pitches, how to be really successful in presenting your research ideas during an event. And then we have also produced a document which is helping you also to better use this video recording that the European Commission, for example, is providing you today. We had a webinar on blind evaluation with question and answer. So going on this document, you can easily identify the answer to the questions which were raised. Available soon, this is also a document we are working on, nearly completed, information on clinical studies, annotated templates. So as you know, you have to submit your clinical studies description according to this template. And we are making some annotations which are useful for applicants and for NCPs to understand better what elements to insert in this document. Next slide, please. So I wanted to show you, I hope it's visible, our calendar of calls, where we offer in blue the call which are health relevant, and in red all the events which are around on the health ecosystem. You will find the EIT calls or even EU for Health calls, as I said, and the partnership calls. Like lately, there has been the launch of one of the call of the partnership transformation of healthcare system. You will find on our calendar. So we think it's a good way for you to know everything which is available. You see in blue the EDCTP call with a deadline in the end of June. So you see, we really try to be as informative as possible. Next slide. Thank you. Again, yeah, this is a zoom into how we show the calls, and you see from the different logos if the call is related to the cluster health with the European Commission flag, the EDCTP with the EDCTP logo. You can add these calls to your Google Calendar, so it's also a nice way to really have nice working agenda for you and your colleagues. Next slide. I'm going towards the end to really say just a few concepts on the successful preparation for all of us of the 2024 health calls. We really offer you here the opportunity to stay in touch with different channels. You will find in one of the next slide. Our electronic newsletter, it's a tool, small but really informative, to be always updated about news that you can use in your proposal preparation. And just have a look to our website to see all the services which are available to get involved. The message is also, we are an international network, so we are really offering services at the international communities of applicants, but of course, always go through your national contact point as the first entry to our community, because they might have, of course, services in your own language and specific service for you in the countries. Next slide. Just to indicate, indeed, our social media account that you can follow. And yes, just to close, the next slide with my contact as coordinator of this interesting project, Health NCP Net 3.0. Thank you to the European Commission for their constant support to the NCPs, and especially to the constant training that they share with us to be more efficient towards the national communities. Thank you, and back to the studio.
Thank you very much, Katharina. And before I comment on your presentation, I'd just like to encourage the audience to send in questions via Slido. The QR code is on our webpage. If you have any questions about the services offered by the NCPs or about the NCP network itself, please send in your questions now. So as you've heard and seen, the NCPs and their network are extremely active. They offer a wealth of information. They beyond the sharing of best practice and training, which they do amongst themselves, they network. And as a network, they are a very good tool to bring people together. Of course, they organize these very popular brokerage events after each information day. And as you've heard, the level of participation is very high. And you can still participate and listen in, even if it's maybe too late to take part in actual meetings, because the event is tomorrow. But just also for future reference, that this is an important rendezvous to help build your consortium. You've heard about the newsletters, the workshops, the toolkit. So a lot of information is available directly and free from the NCPs and the NCP network. You don't necessarily have to go to consultants, and as a first step, you can certainly avail of a lot of information at national and at national level and through the NCP network. I think the calendar is extremely useful. It's something I refer to also myself to have the overview. It's very practical. And finally, you can easily stay in touch with them via their social media accounts, something I also do. So we still don't have any questions. So actually, I was going to ask Katarina about the practical aspects of applying or building your consortium and applying for EU funding. We heard from earlier on from Adina and Soren about the pitfalls of the last-minute application. The need to look very carefully at the work program before launching into the very major endeavor of preparing a proposal. But perhaps, Katerina, from your experience as an NCP, you have some additional comments you'd like to make?
Yes, thank you, Stefan. Yes, as you mentioned, it's the first, I would say, success factor is really to plan the timing in front of the preparation of these proposals. Thanks to the biannual work program, I think that already a lot has been done to support the researchers who are actually always probably very busy on also other activities. I think it's important to really start the preparation of at least the project idea with the core partners of the project with whom you have a stable research activity well in advance. There must be a core consortium, even 2, 3, 4 partners in the beginning who are starting the work and the planning and identifying the objectives of this research project very well in advance. I think this really helps to establish an architecture which is solid and then which can really arrive to the final goal, which is the submission eventually 4, 5, 6 months after. So we also stress when we meet the researchers or the innovators, the companies during the meetings in our offices or on Teams, we really stress the fact that there must be a planning like in every project in life. So no really rush, no project prepared in 2 months, because this is generally not bringing good success unless you are really used to the process, you know the template since decades, then maybe it's possible. So we always like to say to our applicants the number of days, month that the preparation of a European project takes, and we talk about, as a coordinator, in between 45 and 60 full working days as a coordinator to put together the consortium and to structure the proposal. But it could take even more, really, depending on your experience. So we actually, as a national contact point, are planning also to offer some small training and video tutorial on proposal preparation. But I think that this type of service is really the expertise of NCP. So it's good to structure and book with them a very intensive first meeting on the solidity of the project idea and clarifying the objectives, which are then, during the proposal preparation, going to become the work packages of your project. So we think that the first months are really crucial to build a successful proposal. And also, if I can add, we think that also the Horizon Europe scenario in the health cluster is changing. Is changing in the sense that more and more we have different actors and stakeholders to be involved in the project, to build really a project with an impact on the societies, on the area of research. So we see more and more also the involvement of patient association, even decision makers at national, regional level. Those are becoming also important actors that are supporting the real life and really changing the status of things. So really go out of the usual circle and of actors and go and reach the society to collect their views on the research you are performing. We think that this step is also one of the steps on which we need to work better and more.
Thank you very much, Katarina, for this additional guidance, this very practical advice that you give based on your long experience as an NCP. I'll also remind people, if they don't know who their NCPs are, they can find the names of the NCP for their country, for the specific discipline, the part of the work program, the part of the framework program they're interested in, via the main website for the programs. I think we have no questions. I think your presentation was very comprehensive. And so I'm going to conclude this session. Thank you again, Katarina, and your network. I want to thank all the NCPs for the support they give us and they give applicants. And I'm going to hand over back to Soren.
Thank you, Stefan. Goodbye.
Thank you very much, Stefan. Thank you very much, Katarina. I would like to say, in addition to what Katarina just said now, it's very important to keep the vision for your proposal, so that you look at the overall what you want to achieve, rather than only on the technical details to achieve it. Like this, it's much easier for you to make a plan, to put the partners together in a holistic plan. I think that's sort of, for me, the take home that I just got also from what Katarina was saying. And then it only leaves for me to close the session. Again, thank Katarina for very comprehensive and clear presentation, and Stefan to keep an order in all the questions, and all of you for listening and posting questions. And now we will have a short break until 11:15, and then we will resume with Destination 1 of the health cluster, and our colleagues Alina Lupu, who will be the moderator of the session, and Indridi Benediktsson, who will join the session. So thank you very much, and see you soon.